ask for your consent. So if you could consent, or if you'd rather watch the recording later, feel free to drop off. But today I am joined by Doris Chin, who works at the USDA Food Nutrition Service as a nutritionist and served as a regional coordinator. She'll be offering a bit of context and grounding into the SNAP-Ed toolkit and kind of what we're hoping folks will submit this year for review. I'll walk through more, sorry, there must be a timer on this one. I'll walk through more of the technical or logistical side of things, and then Tracy will be providing more of the applied guidance on how to actually complete the form and apply re-aim and some equity frameworks to your responses. And then we'll have time for Q&A. So without further ado, I'll turn it over to Doris.
Thank you, Claire, and welcome. I'm going to turn my video off to improve sound quality while I present. So good afternoon, everyone. I'm Doris Chin, and I'm, as Claire said, I'm a nutritionist at the USDA Food Nutrition Service, the SNAP program. Thank you all for attending this intervention submission training webinar. As most of you know, SNAP-Ed is the functional area, is a functional area of the SNAP program. And the goal of SNAP-Ed, as written here, is to help improve people eligible for SNAP's health and to choose healthy lifestyle and to choose physically active lifestyle using the current dietary guidelines for Americans recommendations. Next, please. So SNAP-Ed is guided by the rules and regulations derived from the Farm Bill, which requires SNAP-Ed interventions to be evidence-based, and that in addition to direct education, multi-level interventions and/or community and public health approaches to be used. Next. Next slide. Okay, so this training is coordinated by the SNAP-Ed Toolkit team at the USDA, at the UNC Chapel Hill. In our SNAP-Ed Toolkit website, you will find the interactive SNAP-Ed evaluation framework, training resources, and a searchable database of evidence-based interventions that have been peer-reviewed. Next. We currently have 140 interventions in the toolkit. After the last call for submission in 2020, 21 interventions were added. And so once again, we are now calling for innovative evidence-based strategies for our toolkit. And next. The USDA continues to encourage SNAP-Ed providers to utilize a public health approach when working with communities. Public health approaches can broaden SNAP-Ed reach and complement direct education to improve program effectiveness. It includes a range of policy systems and environmental change strategies, in addition to culturally tailored nutrition education and food resource management education. FNS has recently updated the Thrifty Food Plan, increasing SNAP benefits to our participants. Many of our interventions include food resource management strategies, which are particularly timely to help participants make healthy food choices for their budget. In addition to encouraging the submission of interventions utilizing a public health approach or multi-level strategies to improve health and well-being of the community they serve, we also want to highlight several audiences, settings, and intervention strategies that are underrepresented currently in the toolkit. These audiences, settings, and intervention strategies are currently underrepresented with that means less than 30% in the list of evidence-based interventions in this toolkit. And you'll see the list up here, listed under audiences, settings, and intervention strategies. I encourage those who are looking to work to submit interventions to submit interventions that are based on these this list here would be preferable. Of course, we're accepting any interventions that you might like to submit. You will also find this list, I believe, in the Qualitracs, in the when you submit in the documents. SNAP-Ed, just a few reminder for SNAP-Ed submission first, or SNAP-Ed interventions. While the SNAP-Ed toolkit welcomes interventions that are not being developed or used by using SNAP-Ed funds, these are some requirements for SNAP-Ed interventions that you need to remember. SNAP-Ed nutrition education messages and goals must align with the most current dietary guidelines for Americans. That's the guidelines that came out in 2020, that is for 2020 to 2025. Intervention materials must not endorse or convey negative written, visual, or verbal expressions about any specific branded products. And intervention strategies and costs of the supplies must be allowable for SNAP-Ed. Now, from time to time, we might have questions about folks trying to use interventions and supplies might not be allowable. Those are opportunities for SNAP-Ed providers to perhaps partner with other organizations that might be able to supply or offset some of the cost. For more information about SNAP-Ed guidance, please refer to our guidance that's hyperlinked here, or consult the regional coordinators for SNAP-Ed. This is a timeline next for submission. As you can see, currently we're doing the training for the submission, and the submission deadline will be January 23rd. That's when submissions will be closed. April 1st is when the decisions will be announced, and then hopefully these new interventions will be integrated in some of the SNAP-Ed programs in the summer or fall when the plans are submitted. So next, I'll hand it back to Claire.
Thanks so much, Doris. We hope that was helpful just to highlight some of the, things that we're looking, or the interventions that would be helpful to round out the selection. I wrote this in the chat, but we will be uploading the scoring tool. So the criteria which your intervention submission will be scored against to the toolkit later this week. And that includes bonus points for interventions that address or are specifically tailored or designed to reach those audiences in those settings and using strategies like social marketing. So I'm going to go over the intervention submission process briefly. This might be new for some people, and I want to just help make it super straightforward and easy for you. The submission form is technically a PDF form, and that's on our website. We're on the SNAP-Ed toolkit right now for you to download. You do have to download it. If you try to view it in a browser, you'll get an error. But the form is there to help you see what questions are going to be asked and help you organize your submission. However, all of the submissions will be required to be sent through a Qualtrics form or survey. So to get a unique link to your submission portal, you'll need to actually first start by filling out a brief form on the SNAP-Ed toolkit under the SNAP-Ed or submit an intervention page. And once you add your name and your email address, you'll receive an email that looks like this. that will highlight some of the key deadlines, like the last day to submit your intervention. After today, we'll include the link to where the recording of this training will live, and then some other resources to help you work through the submission process. This email will have your unique link to it, and you can use this link to open and close your survey at any time, and it will save your progress. So make sure you keep this email marked or like flagged in your inbox, because it's the link you'll use for your unique application. If you are submitting, if your organization is submitting more than one, you will need to submit or generate more than one of these emails so that you can have separate forms. So once you're in the Qualtrics environment, it really mirrors the PDF form pretty identically. There are a few deviations that are minor. One is that questions 14 and 20 are split into several questions. So it will look a little bit different. Here you see it looks like this as a table in the PDF form, but then is broken out into 2 questions in Qualtrics. And then there are some tools to kind of help you keep track when you're working through your application. So there's a progress bar at the top and then navigation bars at the bottom so that you can move back and forth as needed. And again, this is just to help you kind of position where you are in that process. Last year, we went through a process of revising the forms. And so we were able to increase the character limit on several questions, particularly ones that help the reviewers understand the content or like the main objectives and intent behind your intervention. So you'll see each of the questions has a character limit, and that's listed here next to each question. Qualtrics will give you a character's remaining link or reminder as well. And then the character limits do include spaces. So that's something you'll need to keep in mind if you're drafting your intervention submission form or your responses in a Word document. And so just a reminder that if you are copying and pasting your text from Word, just make sure that all of that has been able to be copied over correctly so that the reviewers get the full picture of what you're trying to say. Required questions are indicated by an asterisk, and they will, in Qualtrics, you won't be able to move forward without answering them. So that's what that will look like. And then the last thing, this is kind of some new guidance for giving to folks. One of the biggest pieces of feedback we got from reviewers was that it was really hard for them to meaningfully use the intervention and evaluation attachments that you can upload to complement the responses actually in the form. So this year, what we're recommending is for each organization to rename their attachments to be very short, succinct descriptions of what it is, right? So here we have training manual or like survey. And then we'd also encourage you to, or we are asking you to go ahead and label them Appendix A through E for intervention attachments, and then Appendix F through J for evaluation attachments. And this way, as you're starting to craft your responses, you can help the reviewers find more information, data sets, instruments that might help them assess some other part of your intervention or your submission by directing them there. So you can say, as shown in Appendix A, or in parentheses, Appendix A, as you're crafting your responses. So we hope that will be helpful for the reviewers and you, because that in the past, that has been some of the reasons why interventions haven't been included, because it was just hard for reviewers to really fully assess some of the dimensions of ReAIM without being directed to the key information in the attachments. So when you're uploading things into Qualtrics, you'll click on that gray box and it will bring up your window to actually attach or upload the materials you'd like to include. You want to be careful with the order because you're not able to change that. We can work on the back end to help with that if there's a big issue, but just to be careful when you're uploading things so that they're in the order and the sequence you'd like them to be shared. So I think that is it for me. I hope that's helpful as you think through the technical pieces of it. And we're always happy to answer technical questions and content questions when you have them. So I am going to give Tracy the remote and let her share some of how to apply ReAIM to your intervention.
Thanks, Claire. Yeah, so I'm going to spend some time talking about the application of ReAIM to your intervention. And this is because the ReAIM framework is used to facilitate the review of the intervention. So we're going to just touch on some aspects that will be important to consider. So, oops, sorry. Okay, now I think so before we get into the specifics of ReAIM, I just wanted to, oh, this is going automatically, I think, Claire. I have not touched anything. So.
Okay, let me see if I can help. I'm not sure. I can
keep
drive for now if you'd like.
Okay, sorry, I didn't.
It's okay.
Okay, so just before getting into the specifics of on ReAIM, we just wanted to kind of look at some broader topics for you all to think about as you move through the submission process. So first, we just want to suggest that as you work on the submission tool and the form and the attachments, that you really throughout the process, make sure that you share important details and associated attachments that really help the reviewer to understand how you developed the intervention, how the intervention was tailored to your intended audience, and then also some good documentation around how its success was evaluated. You want me to try, Claire, to advance it now?
Nope. I'll go and then I'll get
got it. Okay. Yes. So before we get into ReAIM, we just wanted to get a sense of how familiar people are with ReAIM. So if you all just want to share and hear what answer choice best reflects your understanding. Okay, I think we're probably pretty close to getting everyone's responses. So thank you. So it looks like we have a varied level of experience, which is great. One thing I just wanted to point out to some of those that maybe are less familiar with ReAIM, if you want to visit the SnapEd Toolkit website, we have a training on ReAIM that may be helpful just for you to get further your understanding of the framework. So now I just want to give everyone an overview of how we're going to move through the rest of the webinar. If you've had a chance to look through the submission form, you can see that it's structured based on the ReAIM, the 5 dimensions of ReAIM. So we're going to follow this same structure as we go through each dimension. For each dimension, we're first going to take a look at some of the questions that will be important for you to address as you complete the submission form that relates to the specific ReAIM dimension. Then we'll share some questions and thoughts for you to reflect on equity as it relates to the ReAIM dimension. And I'm going to touch on this a little bit in the next slide in a little bit more detail. And then we'll also highlight how some answers from existing toolkit interventions, ones that are currently in the toolkit, we'll pull some text from their previously submitted submission forms just to highlight how these interventions address specific ReAIM dimensions. And I just wanted to share with these examples, we really worked to pull interventions that were varied in terms of their evidence base, to the type of intervention or the focus, just to give you an assortment of different interventions that are, as we talk about the ReAIM dimensions. Okay. Okay, so I just wanted to touch a little bit before we get on into the ReACH section, a little bit more about our thoughts on the equity piece. So you'll see as we move through the slides that we offer several reflection questions on how to consider equity within your responses to the ReAIM dimensions. And we just wanted to share that this piece of it, the submission and scoring tools don't explicitly ask about equity, but we really just hope that we can just continue engaging in a conversation about what that means. So we just really want you just to encourage everyone just to, you know, as we all are, continuing to learn about how and what it means to meaningfully evaluate equity in our work. So we'll work first with the ReACH dimension. And when you're working with this section in the submission form, the questions here will just give you some sense of what will be important for you to address in this section. So in a sense, they can serve just as a check to make sure that you've included some important details, such as how the intervention development process, when this was developed, did they make sure that it was appropriate for the target audience? If possible, you'll want to provide information on the proportion of people affected by the intervention, and then also look to see if those reached by the intervention are representative of the target population. So we also, in addition to this, we would like you to visit, as Claire had mentioned, it will be posted later this week, the intervention review scoring tool. And this will just give you a sense of what the reviewers will be looking for as they look at your intervention. For example, on the intervention scoring tool, one of the factors for a high score for ReACH looks at if the cultural needs and preferences were thoughtfully considered and integrated. Okay, next slide. So here are just some questions to think about, thoughts for you to consider in terms of bringing equity into your responses for ReACH. The first set of questions here, and this will be consistent throughout the presentation as we look at the different dimensions. These questions were pulled from the Role of Racial Equity webinar by Latrice Davenport and others. This webinar is on the toolkit, so we'd encourage you all to have a closer look at it if you are interested. And then we also pulled some other questions from a paper by Shelton, Chambers, and Glasgow that just spoke to some health equity considerations as they relate to the ReAIM dimension. So if we look first here, just in terms of Latrice's input, you know, in thinking about ReACH, you may wish to reflect on what the unique needs of your target population are and who determined these needs. And then also what methods did your agency use in order to determine which group has the highest burden of poor health outcomes? And then switching over to the paper recommendations, one of the questions posed there is, who is not reached and why? And you can look at this in terms of a range of social dimensions and social determinants of health. So we're going to first take a closer look at a response for the ReACH dimension using the food share fresh food box intervention. And this is a PSC change intervention that was developed by the University of South Carolina School of Medicine and Arnold School of Public Health. And it's classified as an emerging intervention in the toolkit. And FoodShare aims to improve food security and health through fresh food access and affordability. There are fresh food boxes that are delivered every 2 weeks that include 12 to 14 varieties of fruits and vegetables, as well as a recipe card. So here we'll take a look now at the response from the FoodShare interventions to see how they address some aspects of ReReach. So shown here is their response to question 21 from the submission form that asks you to describe how the intervention reaches the intended population or SNAP-Ed audience segment. And I just, I know that this slide is very text heavy, but I just will ask that you to bear with me because we'll just highlight different pieces as we go to look at how the intervention addressed the specifics in the questions. So one of the questions that is important to address in the ReReach section is to describe what was done when developing the intervention to make sure that it was appropriate for the target audience. So here we can first see how the intervention identified that cost was an obstacle to lifestyle changes associated with making healthy eating choices. In addition to cost, the accessibility to healthy foods was also identified as an issue among the target audience. So in order to meet these needs, the FoodShare interventions brings the boxes into the communities where the participants live. And the intervention also worked to address cultural needs and preferences of their target audience. The developers held focus groups that incorporated and they incorporated the results from the focus groups into the development of specific food produce lists that were based on the personal experience and cultural significance of those that were involved. So here is just a nice example of how the intervention worked with their target audience in order to identify and meet the unique needs of their target audience. So switching next to the effectiveness section, this section of the submission form is the most extensive in terms of the questions and content about what for you to share about your intervention. So it's going to be important here for you to include enough detail to help the reviewer understand things like how the acceptability of your intervention was examined. Is there detailed evidence showing how intended outcomes were achieved, as well as if you have supporting materials and information that help the reviewer to understand how the evaluation was conducted, the evidence-based and unintended outcomes, as well as the lessons learned. So here, just to highlight that the relevant and well-organized attachments are key, and just to emphasize the labeling and structure that Claire suggested earlier will be really helpful for your reviewer to get a good sense of where to go to for additional information. So, excuse me, when answering some of the effectiveness questions, we would encourage you to look and use the SNAP-Ed evaluation framework. You can find it, the address is shown here, but if you go to the SNAP-Ed Toolkit website, you should be able to locate it there. So it's an interactive version that's on our website. And so we would suggest, it's not required, but we suggest if you can to work to align your outcomes as much as possible with the indicators here. And also just a reminder to think about the multiple levels of the SNAP-Ed evaluation framework as you look to describe your program's effectiveness. So as you think about bringing equity into your responses, you may want to think about who is defining success. and who has determined what outcomes will be prioritized. Also, what policies, procedures, or methods has your agency established that ensure that the program outcomes ultimately serve the needs of the community members. And it may also be worth you considering if the health impacts that were experienced were equitable across all groups on the basis of social dimensions and social determinants of health, and think a little bit more in terms of the why or the why not. And lastly, just thinking about if certain groups experienced higher levels of negative effects or burdens. And I know that there are a lot of questions listed here. And again, we just want to highlight that the questions are here for you just to really reflect upon as we're all continuing just to learn how and what it means to meaningfully evaluate equity in our work. So for the toolkit intervention to look at effectiveness a little bit more closely, we'll use the match intervention. And this is a direct education and PSE change intervention that's classified as research tested in the toolkit. And match is designed to decrease BMI and increase healthy eating among physical activity in 7th grade students. So here we can see part of Match's response to question 25 that asks about what intended outcomes were achieved and to what extent. So here the intervention developers have selected a specific outcome indicator from the framework. We can see that the general outcome here is to increase healthy eating among 7th grade students. And then the SNAP-Ed evaluation framework indicator that's relevant was MT1G, which is the percent reporting drinking water at least once per day. And so the way that they described the extent achieved was that 62% of participants, they give the number there as well, reported drinking water at least once per day post-intervention. Another piece that will be important to include and describe is how the outcome was measured. And you can see here that they used a survey administered to students to have them self-report their lifestyle behaviors. And you may be familiar with this in the survey, but you can continually just to add outcome measures as necessary. And so I just want to highlight here that while this information is helpful to give the reviewer an understanding of whether or not the intended outcomes were achieved and to what extent, you'll also want to attach here documents that really provide good supporting information so that the reviewer can just really get a clear understanding of how your intervention outcomes were measured, what tools were used, and then the extent that they were achieved. So we're going to just look at one more question in the effectiveness section for the submission form. And this question asks about unintended or expected outcomes that occurred and to what extent. And again, we've pulled the text here from the match submission form. So we can see here in looking at the question, is there information provided on unintended outcomes and lessons learned? And here, one thing that sticks out is that the developers specifically mentioned the unintended outcomes as well as the unintended benefits as well as the challenges. You can see here just by the highlighted. So they listed both of those, and then they went on to make some recommendations based on what they learned there. So this piece just gives the reviewer a better understanding of some of the unintended outcomes, as well as describing some of the challenges that led to recommendations that could be important lessons learned for future users of the intervention. So for the adoption section of the submission form, these questions will just help for you to make sure that you've covered some important aspects of adoption. So if possible, you'll want to give information on the proportion of settings or partners that adopted the intervention. You'll want to look at if there are differences in the settings or partners that did or did not adopt the intervention. And then lastly, look at if there's information describing how the settings or partners were engaged and what resources were required for adoption. So in terms of thinking about equity and adoption, you may wish to consider how your agency identified community assets and who identified the community opportunities. And additionally, what roles do the settings or partners play after the SNAP-Ed work is complete? Some other thoughts to think about would be, and this was touched on in this slide before, but which settings or partners adopted and applied the intervention and why, which did and did not and why. And then also looking if there are adaptations that might be needed to facilitate adoption. So we just wanted to pause here briefly. I know we've thrown a lot at you all in terms of just questions and then the equity piece. And we just wanted to give you all a little bit of time and space to just share via the chat how the equity questions are feeling, how they're resonating with you. So feel free, if you're comfortable, to chat them in. And we can circulate this list with others at the end if people are interested. Or and yes, we will also, I see a question there. We are definitely will be sharing the slide deck with everyone after the presentation. And we can just feel free as we move through the presentation, if you all, have thoughts around specific equity questions as we move on, please chat them in there, because we just, we're looking to, okay, and I'm just seeing that just the chats are only available to us. So we will definitely share the thoughts that you all have had around this after the webinar. So I'm going to go ahead and move on to looking more at adoption. And then again, I just wanted to emphasize that we can either address questions or whatnot that were put in the chat later. We're happy to work with you all on those. So for adoption, we're going to use the Eat Smart to Play Hard intervention. This intervention was developed by the University of New Mexico Prevention Research Center. It's a social marketing and PSE change intervention. It's classified as practice tested, and essentially the social marketing campaign collaborates to engage students, parents, teachers, and staff, as well as other stakeholders, to eat smart in order to play hard. So here we're going to take a look at Eat Smart to Play Hard's response to question 31 in the submission form, which asks for a description of how the partners or settings contributed to the success of the intervention. So if we look at Eat Smart to Play Hard's response to this question, we can take a closer look at the information in terms of how partners were engaged and what resources were required for adoption. So the highlighted text shown here shows how the intervention was designed in a way that requires minimal work from school staff, which they then share as why principals can easily adopt it. They also talk about how the principals then can readily assist with the logistics of implementation. In terms of the resources required, you can see that families can volunteer for the fun days, and that the campaign also provides support for direct education by other implementing agencies. So we can get a good sense here about how and what types of partners were engaged, as well as some sense of the resources that were required for adoption. So next we'll look at the implementation dimension of ReAIM. In this, for this dimension, really what is key here is that you provide clearly written descriptive information with sufficient detail. You'll want to make sure that the implementation instructions and material are clear and easy to follow, and that the supporting materials show how the main intervention components were implemented with fidelity. So again, just the tip around detailed and descriptive information here is important. So in terms of thinking about equity in your responses, you may wish to think about what roles community members play in making decisions about the SNAP-Ed program being implemented in their community. Also, how is the group of people with the highest burden of poor health outcomes centered in the decision-making about program implementation? And then additionally, what adaptations might be needed to promote equity and address social determinants of health? And the toolkit intervention that we'll use to take a closer look at implementation is Fresh Conversations. This was developed by the Iowa Department of Public Health, and it's a direct education intervention that's classified as research tested. And it's a nutrition education program that's designed to support healthy aging and independence. That includes monthly interactive sessions and newsletters. So here we have Fresh Conversations response to question 35 on the submission form, which asks for a description of the main intervention components or the critical features of the intervention's intent and design that should be kept intact when the intervention is implemented. So as we take a closer look at the main intervention components, and if they're described clearly and with sufficient detail, we can first see that this example does a nice job of referencing documents that are attachments to the submission form that provide additional details. This is an example that was pulled obviously before we have this new push in terms of the appendices and the labeling piece. But you can see here just how the right here, they are directing you to additional information so that you can get a better sense of more details around the intervention. So they reference an attached logic model, as well as a program description and an article. And then they also have an unpublished web page to go to for additional information. You know, we're not saying that every intervention has a published article or whatnot, but more the point here is just to illustrate that you can utilize your responses in this section to draw the reviewer to additional information that can just help provide them more details around what you're trying to communicate within the different sections of the submission form. So we're going to also just look at this response in a little bit more detail too, just to look at how the intervention highlighted the the main activities in the intervention. So we can see that they describe the newsletter and facilitation guide as core materials. They mention how they had the guide has optional activities. They also specify how the physical activity demonstrations are recommended at each meeting, and then the interactive facilitation is essential to the program success. And I also just wanted to highlight here that the inclusion of how the materials can be modified to reflect the needs of their senior audience. They share here in terms of demographics, cultural and social aspects, as the intervention is implemented with different audiences. So now we're shifting to the final dimension of ReAIM, which is maintenance. And for the maintenance section of the intervention submission form, you'll want to share information on a range of factors that may influence the intervention, the maintenance of the intervention. Some of these factors include describing any modifications to the intervention over time and making sure that these modifications are clearly described. Also touching on if there's consistent support from the organizations involved to maintain the interventions and what resources are needed for this support. And then lastly, looking at sustainability concerns, whether these are staffing, funding, or intervention complexity, or for example, those, if those have been identified and addressed. So thinking here with respect to bringing equity into your responses in the maintenance section, you could consider if at the end of SNAP-Ed's investment, did you facilitate changes that the target population was interested in seeing? You may also consider looking at if the intervention is being equitably sustained, as well as if adaptations to the intervention reduce or exacerbate health inequities over time. So for the maintenance example intervention, we will use the cooking as a SNAP. This was developed by the University of Minnesota Extension. It's a direct education intervention that's classified as practice tested. And just in general, it's an in-person culinary nutrition education course where participants practice food preparation skills in order to make cooking and eating at home easier and more rewarding. So here we've combined the responses to questions 41 and 42. And these ask about what adaptations or modifications were made to the intervention over time, and what effect, if any, did these modifications have on the intervention? So now we can just take a closer look at how the modifications to cooking as a SNAP have been described. We can see here that the surveys that were completed after each session were completed by participants after each session, and also how nutrition educators provided ongoing feedback for the course content, methods, flow, and participant experience. And there's also mention of a grant that enabled an effectiveness comparison study of cooking as a SNAP in more rural settings, and how the curriculum was tested for clinic referral and an all audience acceptance. And I think the last sentence that I've highlighted here does a nice job of describing or summarizing how the modifications to the interventions were based on hearing directly from the target audience and the implementers, and how those were prioritized and incorporated in order to meet the needs of the participants as well as the nutrition educators' experiences, while also maintaining the desired behavioral changes. So as we kind of close out the ReAIM dimensions, I just wanted to briefly touch on how the toolkit includes interventions that are categorized as emerging, practice tested, and research tested. You can see here the definitions that are included for each of these 3 evidence-based approaches. And we just wanted to explain these 3 different ones, but also just encourage you that interventions that are based on any one of these approaches are encouraged to for submission in the toolkit. And there's a question at the beginning of the submission form that has you choose the evidence-based approach that best reflects or best describes your intervention. And so just to close out with some final overall tips, you know, one thing that will be important is to really work to concisely summarize your answers to each question while also referring to the relevant attachments as needed. I also just wanted to call your attention to there's highlighted text that there's italicized text that is associated with each question on the submission form. That could be used as a helpful guide for you to structure your responses, and also just as a check for making sure that you've covered everything that is asked in the question. We also wanted to, again, just reiterate to have a look at the reviewer scoring tool that will be posted on the toolkit website. This just gives you more understanding into what the reviewers are going to be looking at in their review. And then lastly, just we're definitely here. Reach out to our team with any questions that you all have. We're happy to support in any way. So with the idea of the support in mind, we just wanted to have you all comment in terms of what you all feel would be the best way, if any, to provide additional support from you all. So if you can spend a minute here to share with us your thoughts, we can take this information. Great. So, excuse me. We will definitely be in touch in terms of holding an office hour with some 15-minute time slots for the team, as well as email communications, and thinking about also maybe including an open meeting session for. And then also just a reminder, I think Claire shared the email address in the chat there. So I just wanted to call your attention to that. So I will pause here there's some additional resources there. I had mentioned those in terms of the ReAIM. You can look at the online training and then the link there to the framework. And then there's our email address.
Thanks, Tracy. We have a few questions in the chat. So I'm gonna start with one at the bottom and then work my way up to make sure we get them all. But Sarah had a question about determining where your intervention fits in the spectrum. And Sarah asked, do you need any specific documentation, say of practice or research tested, to corroborate what an organization chooses?
Yeah, so in terms of the research tested, you would definitely want to either include an external evaluation report, a report that was done by an external partner, or a peer-reviewed manuscript that is on your presentation, and then, your intervention. And then in terms of the practice tested, again, just emphasizing really good attachments that include detailed information on the evaluation of your intervention in terms of the tools used and the extent that those measures, your outcomes were reached.
I'm muted. Sarah and others, I chatted in the checklist to determine your evidence-based level. It is a little clunky to work through. But it has a lot of the key things that Tracy just shared. So it's helpful for you to work through that checklist first. And then reviewers will also be double checking for the right classification.
Yeah, I just wanted to reiterate, thanks for raising that, Claire, that this is, that the question there is just for you to think about what the best one is to describe your intervention, but it will be looked at by the reviewers as well as the toolkit team in terms of kind of cross-checking which one that we feel is most appropriate. So, I wouldn't worry too much about it all in terms of getting it exactly right, but just make sure, that you have the right attachments to support the one that you choose.
Great. Another question asked, does the time frame of previous academic evaluations factor into this process when presenting evidence? Like, for example, is there a point at which a time frame may be counted against you, like more than 5 years ago?
Right off the bat, I would say I don't think so. I think it will be determined just based on the quality of the evaluation. I think the only thing that comes to mind in terms of the over 5 years ago, the interventions do need to be based on current dietary guidelines and physical activity standards. So just making sure that whatever the intervention, draws upon with that is relevant and up to date. But I think, what they're going to be looking for more is the quality of how the evaluation was done.
Yeah, we've definitely had interventions that have been submitted that are pretty old and have existing evidence of effectiveness, and then have kind of like updates or modifications over time, and we'll submit those too. So that's not uncommon.
Mm-hmm, mm-hmm.
One question was, what has been the impact of having the programs added to the toolkit, and any evidence of the value of adding the programs to the list? I think this is a really interesting question, and I think there's a lot to unpack. One thing I will note is that most states require, and SNAP-Ed requires, that strategies that are used by SNAP-Ed must be evidence-based when SNAP-Ed implementing agencies are writing their annual plans. So this is an opportunity for agencies that may have developed or piloted something homegrown to share it more broadly for others to adopt and use. It can also be a way for folks who have emerging or community-based practices that could be really beneficial to SNAP-Ed to get it into the toolkit so that it can be used in plans. So I really love this question. I think there's a lot for us to consider internally, and just I wanted to highlight that one function of the toolkit is that it does need to be the interventions that we write into our plans must be evidence-based and come from that toolkit list. It is 4 o'clock. I think, Tracy, are you okay for maybe like a few more minutes, like 5 minutes over? I do, if folks want to stay on, please feel free. If not, we'll definitely share the recording. I just want to make sure I get everything. So there was another question around, is information about each dimension of the ReAIM framework required? What if adoption at the setting level is not applicable because the intervention was directed at the individual level?
So this one could be helpful just without having all of the details. It's a little bit harder to weigh in. So this could be a good time for us to chat over an office hours slot. So I guess with the adoption piece there, I would say you would, who is the partner or who is actually delivering the intervention. So that would be the group or setting that you would want to talk about in that section. But again, I do feel like, with some of these questions, we'd be happy to kind of spend a few minutes if you share with us your intervention, and we can kind of get a better look at it overall in terms of how we could help for, to guide you in terms of their responses. So yeah, so Nancy, definitely reach out to us and we can follow up with you about that.
There's another question about if an intervention is intending to improve or work towards equity and working to incorporate community input, can we still apply? And so yes, on the lower end of the evidence-based spectrum is emerging, and for an intervention to be classified as emerging, it has to have some theory behind it of why you think it might work. And it can also be a community-driven practice that shows potential for benefit. So like Tracy shared, the intention behind the equity questions was not that we have it all perfect and that we are able just to wrap this up neatly into the submission form. But if you've been working towards this and there have been challenges and you've reassessed or made modifications, like those things are all part of this learning and would be helpful to include. So again, the form doesn't explicitly score based on equity, but we would like to start incorporating these reflections in both the submission and review forms so that hopefully we have more robust examples and ways to talk about this when we revise the form in 3 years. So, and I think I got everything up at the top. Chris asked about general burden for the submission. It is definitely different. I think in previous years, we recommend allocating about 10 to 12 or 8 to 10 hours. I can look back and get the specific burden. We had to actually, because this form is a federal government form, we had to pilot it to assess burden. So we have a better number for you, but definitely depends on kind of where you are in your evaluation process, your development process, what you have handy. But again, part of our role is to be able to support and help take some of the burden out, especially if you have something that's emerging or maybe a little bit not traditional that like Dora said, SNAP-Ed would love more PSE or multi-sectoral strategies. So sometimes those are harder to fit into like the framework when it's really designed to be for like, direct education. So we'd love to be able to chat more with you and help you think through how to present that. Okay, and then there was one question about, so one thing I do want to note is that some interventions included in the toolkit have a cost, right? So like a subscription cost. However, typically that's one thing that's assessed when people are reviewing interventions is what is the cost to deliver this programming? And so that is one thing to consider, when you're, there's a question about kind of this is more of a business for it to build raised beds in schools. So that might be a nuance we might need to help you see if it's the right fit or not. But typically we're looking more for interventions that have established evidence that could be adopted and delivered by other SNAP-Ed agencies across the country. So I think, Tracy, you might have been scrolling. I feel like that was everything. There's some in the Q&A. How do we ensure we're on your email list? If you could email us. We generally promote stuff through the ASNA listserv and SNAP-Ed Connection. So if you want to email us to that, that'd be a great way. And then one of the questions is about methods used in data collection to ensure it was implemented with fidelity. If the intervention is added to the toolkit, is this type of data something SNAP-Ed would collect? So it depends, I think, on the state where they would be using your curriculum or intervention. what types of evaluation they would do at that level. We do, once we add something to the website, we do share what evaluation tools are available to support implementation and evaluation in other sites or areas of the country. So depending on what is included in your fidelity check, it might be helpful. I'm a big process evaluation fan, so I think fidelity checks are great. But yes, okay. Okay, great. Thank you, Joanne, for this reflection. Yeah, I think, and I hope that equity questions were helpful. You know, some of the questions came from a racial equity webinar, and like, while race should really be centered in this conversation because it is structured to create and, you know, hold power or access to resources, a lot of those questions could be applied for a lot of different intersections of ways in which communities are structured, right? So that could be like rurality, urbanity, gender, sex, orientation, right? So we hope those are helpful for just starting to think about, you know, who is holding decision-making power? Are the programs we're developing really coming from the needs of the communities we're working with? And also, when we're thinking about effectiveness and reach, are we really reaching and having the intended outcomes that are needed? And on the other side of that, are there people who are being excluded, and why might that be? So we hope they're helpful reflections as a starting place. Okay, I think we got everything. Anything else, Tracy?
No, not that I can think of outside of just, yeah, feel free to reach out to us with any specific questions or any way that we can help you all. So,
yes, thank you y'all so much. We'll be posting this in the next few days and uploading the scoring tool. So we recommend also downloading that so that you can kind of see the questions that reviewers will be looking to score you on and the criteria that they'll be looking to score you on. So thank you all so much. Good luck with your submissions. And we're here for you through January or when you get it submitted. And thank you, Tracy.
yeah, sure. Yeah.
Have a great afternoon, everyone.
Take care, everyone.